So this is a keyhole procedure performed via a vein in the leg, where we use a specific device to repair a leaking mitral valve. So rather than the conventional treatment, which is open heart surgery to repair a valve, this is all done through the vein in the leg using a catheter with the patient asleep under general anaesthesia, and it's guided by an imaging catheter in the esophagus. And we use this catheter to pass equipment from one side of the heart to the other. And we use a clip device, which is like a large clothes peg, if you like, to capture leaking valve leaflets and bring them together. So it does something like a stitch would do in a real operation to stitch the leaflets of the valve together. And that's particularly helpful when there is a floppy or loose leaflet which is causing a significant leak. And it's a procedure which is carried out over about an hour, hour and a half. It's an extremely low risk procedure. So even patients who have high risk for a normal operation can have this procedure carried out at very low risk. So it tends to be used for those patients that are higher risk or unsuitable for a normal surgical operation. It is carried out really as a day case or an overnight stay in many patients. They're given an anaesthetic, they have the procedure for an hour, hour and a half, they're woken up, they're mobilised quite quickly, and most patients go home the following day or sometimes the same day. It's worth mentioning and emphasising that this particular treatment can also be used to treat leaking tricuspid valve. So the tricuspid valve is on the right-hand side of the heart and often leaks in a similar fashion to the mitral valve. But this clip technique can be used very effectively to treat leaking tricuspid valves. And if anything, the procedural risk is even lower than when we treat a leaking mitral valve. So I mentioned briefly that the procedure involves clipping or capturing loose or floppy leaflets and bringing them together. And that's usually what causes a leak through the mitral valve, so a floppy or loose leaflet. And the clip, as I said, it's like a large clothes peg, if you like, brings those leaflets together and restores the normal valve architecture or anatomy. And it's very effective in treating loose or floppy valves and reduces the leak from sometimes very significant to very mild. And it's a very good symptomatic treatment. It's a very effective treatment for many patients, particularly those who are higher risk or who cannot have surgery. So the benefits are, as I said, it's extremely low risk treatment. It's a very effective treatment at reducing a leaking mitral valve, and a leaking mitral valve causes significant symptoms. So breathlessness, fluid accumulation, particularly swollen ankles, swollen legs, and often prompts admission to hospital with worsening symptoms. So the keyhole procedure treats that. It reduces the leak, it removes the leak in many patients, reduces it to a very mild leak, and restores quality of life, reducing these symptoms, reducing the risk of hospitalization with breathlessness and fluid accumulation, and generally improving things like exercise tolerance, exercise capacity for patients. So it's a very effective treatment for symptoms. When a patient presents with a leaking mitral valve, we consider all potential treatments for them, which includes the standard surgical operation, which involves general anesthesia, going onto a bypass machine, the chest being open and the valve being repaired or replaced. We consider other slightly less invasive forms of surgery, so minimally invasive cardiac surgery is performed from the right side of the chest, again with the patient on bypass, where the valve is repaired using endoscopes or endoscopic equipment. But again, that's a big procedure for many patients. And we consider mitral transcatheter edge-to-edge repair for patients who are higher risk for conventional or endoscopic surgery, particularly older patients or patients who have other medical conditions which put them at higher risk, and in whom we think we can get a good result by clipping the leaflets of the valve together. So it's a very considered decision for the patient. We consider a range of treatment options. So the risks of the procedure are extremely low. So we tend to quote a 1 in 100 risk of a major complication during transcatheter mitral repair. These include injury to the esophagus or stomach from the imaging catheter or imaging probe which is used. There's a small risk of bleeding or bruising where the tube is placed into the groin. And there's a small risk of damage to the heart during the procedure. So that can cause an accumulation of fluid around the heart, what's called a pericardial effusion. And that's a potentially life-threatening complication, but is usually treated effectively by drainage. And that risk, again, runs between 1% and 2%. And with any catheter-based procedure where we're placing tubes across one side of the heart to the other, there's a very small risk of stroke. But again, that risk runs at about 1 in 100. So overall, the risk of a major complication is in the order of 1 in 100. In very rare cases, when we cannot clip the valve leaflets or we run into a problem with the devices themselves, there's a small risk of needing open heart surgery or an operation to correct that, but that happens in less than 1 in 250, 1 in 300 cases, so it's extremely rare. So the recovery is extremely rapid. So I mentioned that patients will usually come in on the day of their procedure. They will usually go home the following day, sometimes the same day, and the recovery is within a matter of days. So it's recovery from an anesthetic, it's recovery from the small tube that goes in the groin, but even the more elderly patients feel better and have recovered within a couple of days of the procedure. So it's a much quicker recovery than a standard surgical operation.